Sports massage is a postgraduate course for people who have completed their foundation training in holistic massage. Many elements of the syllabus are geared directly towards sports, particularly treating in pre- and post-event situations, while other components of the course are suitable for the general public, people who suffer from overuse and repetitive strain injuries, most commonly now being referred to as occupational athletes. On the course we'll learn how to test, identify and treat a range of soft tissue injuries and dysfunctions. So we'll learn to tell the difference between a ligament problem, a tendon problem and a muscle problem, and how to use the appropriate sports technique in each situation to effect a result. The theory of this course will go into quite a degree of depth on the muscular system, covering information on muscle physiology and how a muscle functions, different fibre types and how they're affected by different elements of sport. We'll also look at a lot more detail on individual muscles, where we'll look at the origins and insertions for each muscle, as well as actions. And this helps us to understand how to perform our specific sports massage techniques, as many of the techniques require the muscle to perform its action in order to appropriately effect a result. What follows is a short demonstration of some of these techniques and a brief description. Sustained stretching is one of the techniques used in connective tissue massage. It releases adhesions in the subdermal fascia to increase circulation and to restore freedom of movement. Skin rolling is another connective tissue massage technique. Here we see evidence of the effect of connective tissue massage on local circulation. Note the erythema or reddening of the skin. Skin rolling dynamically lifts the skin away from the underlying muscles, breaking down adhesions and increasing tissue pliability. Neuromuscular technique involves palpating and then releasing neuromuscular trigger points to alleviate pain and to restore normal muscle function. Pumping and stretching movements help to release the affected muscle fibers and to prevent the trigger points reforming. Soft tissue release can be performed passively, with the therapist moving the limb, or actively, where the client performs the action. Here we see an STR on the muscle-tendon junction of the quadricep muscles. This is a powerful tool for breaking down fibrosis and scar tissue in muscle and other soft tissues. Muscle energy technique uses the nervous system's control of muscle to effect a lengthening in shortened, contracted tissues. The client first contracts and then relaxes. The muscle is then brought to a new length. This can dramatically increase the range of motion. Muscle energy technique can be repeated a number of times. Each repetition increases the range of motion, and eventually full function can be restored. In addition to these advanced sports massage techniques, training will also include the theory and the practice of thermotherapy and cryotherapy. We'll include training on stretching exercises and strengthening exercises, so that you're not only providing your client with the best treatment in the clinic, you're also providing them with the best home care advice. Applicants are invited to come in for an informal interview to discuss the course further. Contact details can be found on our website.